Betcher.
And I'm Dr. Booth.
Today we're talking about thoracic outlet syndrome. So, what is thoracic outlet syndrome?
Thoracic outlet syndrome. It happens when we do a lot of this or we're stressed a lot. But thoracic outlet syndrome is interesting because there's a lot of nerves and vasculature or arteries and veins that exit through the side of your neck and go down to your arm. And there's not a lot of space there, so when things go wrong, it can actually start having symptoms that go down to the arm. There's a lot of compression across either vasculature or neurologic structures, meaning nerves. And that stuff is very easily compressed because, like I said, it doesn't have a lot of space. There's people that have really stiff upper ribs. They'll have tissues and muscles that are around here that can kind of get really stiff and stuck, and that's usually what this thoracic outlet syndrome presents with. There's also other thoracic outlet syndromes that are similar. It happens in sports. There can be a brachial plexus traction injury, meaning someone's shoulder gets hit really hard and then it'll reactively kind of spasm up. That's another one, but we're talking more about the common presentation of thoracic outlet syndrome, which is a lot of guarded tissue around the neck.
Yeah, around those nerves. So, as Dr. Booth demonstrated, a lot of times it involves more of this like rolled shoulder, tight pecs, things are just compressing, the nerves are coming out of the specific spot of your neck that go into the shoulder and your arm. And that's exactly what you could be experiencing, whether you're a drummer that's working in front of you a lot, or just at a desk all day, or even just stressed via work, life. I know a lot of us have been. So a lot of times what that presents as you can get discomfort, whether it's pretty local right here, or it can even go kind of down into the shoulder. You can get tingling sensations, numbness in the arm or in the hands, and just kind of like this upper body arm feeling of kind of just groggy, heavy, cloudy, just kind of like, why does my arm feel not how it normally does?
Yeah, those are typically what we hear from patients when we start to cue into some of this thoracic outlet syndrome as being a potential diagnosis. Like she said, pins and needles. Just be aware that this pins and needles, it can be on one side and it can mimic like single-sided arm pain, which is sometimes kind of scary because a lot of people know that the left arm can have like a heart-related condition or heart attack be one of the symptoms. That's why it's really important to get this stuff medically assessed and get a proper diagnosis on some of that stuff, because there is similar symptoms on certain types of diagnoses, but it doesn't always mean, oh my gosh, something terrible. It could mean thoracic outlet syndrome. If you are having something that you really are concerned about, go see a medical provider, go get a medical examination done, and if you have this type of symptom, the tingling and the single-sided arm symptoms, plus some heavy, hard to breathe, that's ER. Go to the ER as soon as you possibly can. Get that evaluated. But that's kind of how it presents. What happens? Why does it happen? Like, what's the common cause of some of this stuff? Like Dr. Betcher was saying, we do have a stress-induced type of thoracic outlet syndrome, and we have a biomechanical induced thoracic outlet syndrome. They can happen together, or they can happen kind of separately. We've had both. We've had multiple cases over the year where we've had just a pure biomechanical stress, meaning what they did throughout their day, meaning how they moved or how they didn't move, created some of this stuff. Or the opposite, having a little bit of like the stress-induced, meaning they don't know how to not clinch and be tight all the time because they're under a lot of stress. Those are the things that are the whys behind this type of diagnosis. Anything else on the why?
You hit it pretty well. It's just, like it can either be stress or biomechanical. Biomechanical, we're just talking about, a lot of stuff tightening around and compressing those nerves, hence getting those symptoms down the arms. Or again, just stress related, meaning you just can't take your body out of this really tight compressed phase and still getting those same symptoms down the arms.
Yeah, that's spot on. Another thing to think about is if that stuff does compress and it starts to have some of this irritation for a long period of time, it can be a little bit longer to treat. With neurologic structures or nerves, that once that stuff becomes really inflamed and really irritated, it takes a while for that stuff to kind of revert back to a normal baseline. So even if you think you're not getting anywhere and your progress is stalled, just know it can take a little bit of time to get from point A to point B. So chase those little wins. If you start to have less frequency of the tingling, if you have bouts when you don't have it, but it does come back, those are things that are actually progressive, and it can mean that you're actually moving in the right direction. So next is, how do we treat this stuff? It can be done a ton of different ways. There's a lot of different things that go into it, but some common things that we really look at is breathing mechanics, how this patient is dealing with their breath. A lot of times this has to do a lot with the stress-induced patients. Yeah, so this is a very common, maybe not to that extent, but that's the type of breath pattern that they'll have. They'll be really rigid in their breath, they'll take shallow breaths, and we tend to teach them how to not do that. So Dr. Betcher will teach me how to do some breathing, and then after we look at, maybe that's a treatment for more of the psychological aspects of this or the stress-induced. We'll look at a biomechanical treatment and getting some of the areas right around the ribs, the clavicle, the upper thoracic and lower cervical spine. See if we can get some of that stuff to open up for us. So first things first, we'll go through some breathing from Dr. B. Let's switch the camera up. And here we are. Cool.
We're still going?
Yep.
Okay, so when it comes to breathing, when you think about your lungs, they're in your chest cavity. So yeah, I would say we do expect there to be movement coming from your chest, okay? But your lungs are kind of like a balloon, meaning when they expand or when you inhale, they should be expanding 360, meaning that they should also be working your diaphragm and pushing air down. A lot of times we see that we just start using our neck muscles and our chest to just lift up our chest to get that nice big breath, but really we want to expand those ribs, those lungs 360 and get like a full expansion into the entire torso. So how I like to say, hey, let's kind of go through something that we call diaphragm breathing, make the chest not as big of a component. I'll have Dr. Booth put one hand on his chest, one hand on his stomach. We like to kind of make sure that your rib cage is down or that you're not arching your back while you do this, a nice canister, a nice solid core. And I'm just going to have him breathe. And I just kind of want him to do natural breathing to see what he does. And then we want to, you can see, big chest lift up. And after I point that out to him, I'm going to say, now when you breathe in, when you inhale, focus on less movement coming from that hand on your chest and more with the stomach. Good. So then we see like he's hardly moving that chest at all and really pushing his lungs down into his diaphragm and expanding from the chest. Now nothing up here is tight and working and doing that work. It's relaxed and we're still getting big breaths in using our diaphragm to push down into the stomach.
Cool. All right, so that's a stress-induced. So if we're looking at biomechanics, we're going to see if we can get the, like I said, the complex kind of like right at the base of the neck into the shoulder area. We're going to see if we can loosen some of those areas up, specifically the ribs. Dr. B was touching on what are called our accessory muscles. They kind of attach right to the ribs that are right up here next to the collarbone, and they will pull and try to get the ribs to move a little bit when they're used maybe a little bit incorrectly or in a time when you shouldn't be using them all the time. So we're going to see if we can get the upper ribs to release. So I'll have Dr. B lie face up for me. A lot of people don't know this, but we have ribs that start right up here at the base of the neck, and they go all the way down to here and they wrap around the front portion of our body. We're gonna see if we can get Dr. B's first rib to adjust here. So I typically like to put my hand between me and the patient. I'll put my hand on top of that. This one's gonna reach behind me like they're giving me a hug. And then I'm gonna rock the patient towards me. Their head's gonna still stay rested. I'm gonna poke around back here and see if I can find anything that feels at all stiff, stuck, tender, achy. So found one. I'm gonna put my hand back there, and then we're just gonna add a little bit of pressure, see what it feels like. It actually kind of popped already, but we'll see if we can get a little bit more. So I'm gonna have the patient take a deep breath in, and then exhale, and then add a little bit of a pulse. Right through there. So that is getting enough pressure to get the rib to move around for us, so then the ribs can do this again without having those muscles really kind of attached to them and make it hard for that stuff to move. So that's a biomechanical input to see if we can open up the upper back and the neck area to, again, release some of like the scalenes and some of the other muscles that live around the neck. So hopefully you guys learned a little bit about our thoracic outlet thought process, and if you have any of those types of symptoms and you need treatment or you need to ask someone about them, please reach out to us at 702-558-2151 and we'll get you taken care of.